A whopping 79% of people with kidney issues lack important vitamins. Did you know the word vitamin comes from Latin meaning life? Although vitamins were once believed to contain amino acids, later discoveries corrected this. However, their crucial role in keeping us healthy is still clear. Taking care of your kidneys is crucial, and vitamins play a big part. Even though kidneys work hard to filter and clean our bodies, we often don't notice. While healthy kidneys clean our blood well, problems can cause serious health issues, often linked to not having enough specific vitamins. Eating foods with vitamins is a great way to help your kidneys and you stay healthy. But not all vitamins are the same, especially if you have chronic kidney disease, or CKD. Medicine and waste in your body can affect how vitamins work. In today's video, we'll talk about 3 important vitamins for kidney health and how to include them in your diet. We'll also share a key point about certain vitamins that might be bad for your kidneys, especially if you have kidney disease. Paying attention to these details is important for your health. We hope you watch the whole video carefully and join us in taking charge of your kidney health. So let's dive into the 3 best vitamins for kidney health. 3. Vitamin D. Vitamin D is essential for kidney health, but obtaining a daily adequate amount can be challenging. This is because it's found primarily in foods enriched with the vitamin. An alternative source is sunlight exposure, serving as a natural means to acquire the essential vitamin, in addition to some food sources and supplements. Once your body absorbs vitamin D, the kidneys play a crucial role by converting it into an active form that your body can effectively utilize. This vitamin D metabolite is like the body's vitamin D storage locker. The kidneys transform this vitamin into the dynamic 1,25-dihydroxy vitamin D. Now, the actions of 1,25-dihydroxy vitamin D begin working in harmony to elevate calcium levels and shape the skeletal scene. It increases the absorption of calcium and phosphate in the intestines, ensuring your body gets the nutrients it needs. But that's not all. It throws a curveball to PTH, parathyroid hormone, the calcium regulating hormone, by putting the brakes on PTH production. 1,25-OH-2D plays a crucial role in maintaining a delicate calcium balance in the body. Now let's talk about bone health. Osteoblasts are like builders, making and fixing bones. With the help of 1,25-dihydroxy vitamin D, they get the green light to form bones. On the other side, bone resorption breaks down bone tissue. Here, 1,25-dihydroxy vitamin D helps balance the work between osteoblasts and bone breakdown. It's like a conductor in a symphony, keeping bone remodeling in check. Studies have demonstrated that maintaining sufficient vitamin D levels is not only necessary for optimal kidney function, but also contributes to slowing down renal failure and addressing various aspects of kidney disease. Moreover, it plays a role in reducing inflammation in the kidneys, contributing to the prevention of kidney damage and the progression of kidney diseases. Furthermore, studies have shown that vitamin D not only supports calcium absorption, but also boosts the uptake of other vital minerals like iron. Given that about 42% of Americans are deficient in vitamin D, it's necessary to be mindful of your vitamin D levels and intake. Your healthcare provider can assess your levels and recommend appropriate supplementation if needed. There are different types of vitamin D supplements available, and your healthcare professional can guide you on the type and amount suitable for your specific circumstances. For individuals undergoing dialysis, vitamin D can be administered orally or through injectables during treatment, depending on the recommendation of your healthcare team. 2. Vitamin B. A group of 8 essential nutrients, B-complex vitamins play unique roles, working harmoniously to maintain overall health and support kidney function. This group includes B1 thiamine, B2 riboflavin, B3 niacin, B5 pantothenic acid, B6, pyridoxine, B7, biotin, B9, folic acid, and B12, cobalamin. Vitamin B1, thiamine, is the powerhouse behind converting carbohydrates into glucose for cellular energy, benefiting the nervous system. Interesting fact, research suggests that individuals with diabetes may have significantly lower B1 levels. High doses could potentially reduce kidney disease progression in type 2 diabetes patients. Let's talk about vitamin B6, also known as pyridoxine. This essential vitamin plays a vital role in regulating the metabolism of amino acids and other nutrients, crucial for maintaining healthy kidney function. But that's not all. Vitamin B6 doesn't stop there. It also steps into the world of neurotransmitters, contributing to their production. This not only enhances mood, but also works to reduce stress levels. It's not just a vitamin, it's vital for proper organ functioning, especially the kidneys. Teaming up with B12 and folic acid, it synthesizes proteins crucial for cell formation, preventing anemia by ensuring adequate supply of red blood cells for oxygen transport throughout the body. And cobalamin, like other B vitamins, is indispensable for cell creation, promoting kidney health by providing essential nourishment for optimal functioning. Moving on to folate, vitamin B9. It collaborates with cobalamin to foster red blood cell production and maintain cellular health. Low levels can result in oddly shaped red blood cells and anemia. Here's a bonus tip. Vitamin B9 or B3 niacin may help slow down the increase in phosphorus levels in people with kidney disease undergoing dialysis. Excessive phosphorus can strain the kidneys, worsening existing damage and leading to issues like kidney stones. Evidence indicates that supplementation with folic acid may mitigate the risk of chronic kidney disease progression. B9 not only contributes to kidney health, but also plays a crucial role in preventing congenital disabilities in pregnant women. Ensuring adequate levels of folic acid is particularly important for women with kidney disease as they navigate the journey to starting a family. Vitamin B7, also known as biotin, plays a crucial role in regulating the metabolism of fatty acids and glucose, which is vital for maintaining kidney health. But its benefits don't end there. Vitamin B7 also contributes to maintaining healthy skin and hair, which can be particularly beneficial for individuals with kidney disease who may experience skin and hair problems. Wrapping it up, while vitamins can't replace dialysis or kidney surgery, they play a supportive role in maintaining kidney health. Whether dealing with chronic kidney disease or aiming for prevention, vitamins contribute to restoring a balanced state in your body. Remember to always consult with your doctor before adding new vitamins or supplements to ensure they're suitable for your specific condition. Number 1, vitamin C. Concluding our exploration, vitamin C emerges as a vital component to overall health, including kidney well-being. Its role in infection prevention and wound healing solidifies its importance in supporting kidney health. Our bodies can't produce vitamin C, relying on food or supplements as the source. A 2023 review suggests that vitamin C may offer anti-inflammatory and antioxidative benefits for those with chronic kidney disease, potentially alleviating symptoms like inflammation and oxidative damage caused by free radicals. In certain cases, vitamin C supplementation might be recommended, especially for individuals undergoing dialysis. When you maintain a healthy daily intake of vitamin C, your kidneys play a vital role in distributing it throughout the body, enabling you to produce collagen, absorb essential iron from leafy greens, and generate infection-fighting white blood cells. Moreover, there's evidence suggesting that vitamin C may contribute to decreasing creatine levels in the body. For instance, a 2021 review found that vitamin C helped increase creatine clearance in individuals undergoing kidney transplant surgery. Vitamin C, being water-soluble, readily dissolves, absorbs, and gets excreted by the body. Hence, a consistent supply of vitamin C is necessary, with most individuals advised to consume between 60 and 100 milligrams daily, around 90 milligrams for men and 75 for women. with a tolerable upper intake level of 2,000 milligrams. Most people can consume up to this limit without experiencing adverse effects. However, it's crucial not to overdo it. Once you exceed about 1,000 milligrams of vitamin C, your body likely won't absorb any more, and the excess will be eliminated through urine. Moreover, excessive vitamin C intake can lead to negative outcomes such as diarrhea and an increased risk of kidney stone formation. Thus, moderation is key when it comes to vitamin C consumption. Vitamin C doesn't serve as a cure all. In summary, sticking to the recommended 60 to 90 milligrams of vitamin C per day is unlikely to harm your kidneys. While a healthy body can generally handle higher amounts, megadoses beyond the recommended daily allowance may pose risks, including the potential formation of kidney stones and other health concerns. Remember that the golden rule is to handle vitamin supplementation with care and loop in a healthcare pro for that expert touch, especially when struggling with kidney disease. Now that you're loaded with must know information on kidney friendly vitamins, spill the beans. Do you have any favorite vitamins in your kidney care routine? Your journey might just be the beacon someone's been looking for, offering guidance and support. Big thanks for riding this health wave with us. Give that like button a high five, hit the subscribe for your regular health fix, and why not spread the wisdom? Share this good stuff with your friends and family.